All right. My name is Brandy Cloud. We are doing scenario number 4 for our video interview number 2. This is my subject. His name is Eric Olson. All right. Hi, Eric. My name is Brandy. I'm a psychiatric nurse, and we're just going to spend some time talking today, if that's okay with you.
That's fine.
Everything you tell me here is confidential, except if you tell me that you're going to hurt yourself, hurt somebody else, or that someone's abusing the elderly or a child. Those are reportable. That's reportable, and I have to let somebody know for the safety and well-being of others. Okay?
Okay.
So we're just going to get some just general information. Your name is Eric.
Yes. That's correct.
How old are you, Eric?
35 years old.
All right. And do you have any children?
Yes, I have 2 kids, 11 and 13. They're with their mother for the summer.
Okay. Are they boys or girls?
Both boys.
All right. And tell me what brought you in today. What happened?
Apparently, I had passed out or something, and I must have cut my wrist. Or I don't know. I'm really not real sure, but my neighbor brought me in because she was scared that I had hurt myself or something along those lines.
Okay. So your neighbor brought you in today.
That is correct.
Did you try to hurt yourself?
Not that I can remember. I can't imagine that I would do something like that. But,
what was the last thing you do remember?
I was having a drink on my couch. Outside of that, I was watching TV. So.
Were you alone?
Yeah.
Okay. Has anything like that happened before?
No, not at all.
Okay. So your neighbor brought you in. Has anything else been going on that brought your neighbor to check on you?
She seems to think that I'm not feeling all that well. But I mean, was it 3 years ago? I just got out of a relationship. Well, just got a divorce, and about 2 or 3 months ago, I just broke up with a woman that I've been dating for 2 years.
So how have you been feeling?
Just been going to work and coming home and getting everything done. So I'm just not feeling good. I'm not feeling bad. I'm just middle of the road.
So you kind of feel blah?
Yeah, that's a good explanation of it.
So you said, now did the symptoms start 2 or 3 months ago, or did they start during your divorce 3 years ago?
I guess you could say that they started during the divorce. I don't know. I guess I really haven't been paying attention too much.
Would you say that things have been getting worse over the past couple of months since your breakup with your girlfriend?
I haven't been feeling any better, but I don't know that I would think that I would say that I would feel worse. But I guess it's possible.
Okay. Has this blah feeling affected your health at all?
Not that I can see. I get up, I go to work. I'm a little bit tired every day, but that's probably because I just don't sleep as much as I used to.
So you're not sleeping as much?
No.
All right. What about at work? Have your feelings or moods been causing any problems at work?
No. As far as I know, my work isn't suffering. My boss and my associates haven't provided any issues that they know about. So.
Do you feel like you're as productive as you used to be, or you're feeling less productive?
I mean, every once in a while I have those days where I don't feel all that productive, but nothing different than normal, I would guess.
Okay. Have you tried anything to make yourself feel better?
Like what?
Anything. Like, I don't know.
I mean, I don't use drugs.
I mean, have you tried to get, like, online dating or
dating?
I mean,
no, I think I've pretty much decided I was going to take a little time off from all that.
Okay. Do you feel like you've been able to be as present for your boys as over the past couple months? Or not?
I wouldn't say that there would be any change, but I don't know. I mean, they haven't said anything.
Okay, so nothing that you're aware
No.
of. Okay. And you can call me Brandy. It's okay.
Well, I was raised in the South, so.
I understand. So have you ever had feelings like this in the past?
Well, What do you mean feelings like this?
Or you just felt blah?
Yeah, every once in a while I'd go through periods of time where I would feel like this, but normally it just kind of went away, or I didn't really.
Have these periods been throughout your life, or since you hit a certain age, or?
As far as I remember, they just come and go. I mean, nothing.
Okay. So they just kind of come and go
Steady,
throughout life?
Yeah.
And nothing seems to bring them on, or?
Not that I can picture.
And nothing seems to just make them better, they just seem to get better on their own?
Yeah, it's the only way I would be able to explain it, yeah.
Okay. Have you ever been diagnosed with anything like depression or anxiety or anything like that? What about your family? Have you ever had any family history of depression or anxiety or anything?
My family's not very big on talking about medical issues, so I wouldn't have a clue.
So they don't really talk about how they're feeling or anything like that?
No.
What is like your view on mental health?
I don't really know a lot about it, so I wouldn't have a clue.
Okay. Do you have any like religious beliefs? Are you Christian or Muslim or Buddhist?
I consider myself a Christian, yes.
Okay. Are you currently involved in a church?
No.
When was the last time you were involved in a church?
Oh, it's probably been since before my ex-wife and I got divorced.
Okay. Do you have any specific feelings regarding your divorce that maybe, was your church okay with you getting the divorce?
At that point in time, I don't feel like the church has any say over what happens with me and my family ultimately. And I would imagine that they should be there more for support than anything.
Okay. What about your family?
They weren't exactly happy about it, but ultimately I think I convinced them that it was the best course of action.
So they're supportive. They may not have.
They may not have liked it, but yeah.
Okay.
They still love me, or at least they say so.
Do you feel like you could tell them like what's going on and what's happening in your life, and that they would understand?
Probably not. My family's not really been one to. We never really talked about our feelings.
Okay.
And, we didn't sit around a campfire singing Kumbaya or anything like that.
Okay. So it's just not really something that you guys do.
No.
You kind of just deal with it on your own.
Yeah, pretty much.
Do you feel like if you told them that something was going on, that they might think less of you? Or that they may not support it? They may judge you in some way?
I can't imagine that they would, but I would imagine that they would support me just like they've supported me before.
Oh. Alright. So, have you ever been hospitalized?
Well, I cut my leg open when I was 10 years old.
Okay. So is that the only hospitalization you've ever had?
That's the only one I can remember, yeah.
Okay. How did you cut your leg open?
I was driving down a hill and brakes went out on my lawnmower and I hit a wall.
Well, that's got to be painful.
The piece of metal going through my leg was a little more painful than anything.
Oh my goodness. Do you have any problems with it now, your leg?
Yeah, I had some atrophy from my muscles, but I built them up. The actual biggest problem was from football. So.
Okay. You have injuries from that?
Yeah, my knees took a beating.
Okay. So you have bad knees? Yeah. Have you ever had any surgeries on those knees?
No.
Do they cause a lot of pain or just?
Stiffness more than anything. Okay. Stiffness, swelling.
Have you ever taken any psychiatric medications?
No.
Have you ever done any kind of psychotherapy or marriage counseling or
Nada.
Pre-marriage counseling, anything like that?
No.
Okay. Now, I know your neighbor's concerned about the marks on your arm.
Mm-hmm.
Have you ever tried to hurt yourself?
No.
Have you ever thought about hurting yourself?
No. I have 2 boys to look after. I can't do that.
So you don't ever feel like you want to end your life?
No.
Okay. So these next questions are not designed to get you in any trouble or anything, so don't report them. It's just information for us, okay? Do you use any kind of illicit drugs? Marijuana, cocaine, LSD, anything like that? What about caffeine?
1 or 2 sodas a day, maybe.
Okay. Do you smoke cigarettes?
No.
What about alcohol use?
Normally, I'd probably maybe 2 to 4 drinks a night.
2 to 4 drinks a night. Now, when you say drinks,
standard tumbler.
Standard tumblers. Yeah. Okay. Have you ever had any DUIs or ever been arrested?
No.
No. Did you ever serve in the military?
No.
Okay. So the next questions are just physical health questions and just general stuff. Do you have a primary care provider?
Yeah.
All right. Would you mind giving us their name?
Yeah, I'll give it to you afterwards.
Okay. Are you on any current medications?
No.
All right. Any vitamins, supplements, anything like that?
Not that I'm...
Okay.
No.
And other than the leg surgery when you were 10, have you had any other surgeries? All right. Are you allergic to any drugs?
Not that I know of.
Are you allergic to any foods?
No.
What about dyes?
No.
Okay. So I'm just going to ask you some general medical questions, and you just let me know if you've had any problems or not.
Okay.
Right? Have you been experiencing headaches?
No.
Any dizziness?
No.
Changes in vision? Ringing in the ear?
No.
Sore throat?
No.
What about any dental pain or anything like that?
No.
Have you been intolerant of, like, it's just way too hot, or I can't stand the cold?
I don't like idiots, but no. Sorry, the hot or cold doesn't bother me all that much.
Have you noticed any changes in your hair or your skin?
No, not recently.
Okay. What about heartburn?
Only if I end up drinking too much at work or something like that. So.
Any chest pain?
No.
Shortness of breath or history of asthma? Any chronic abdominal pain or where you have like irritable bowel syndrome or colitis?
No, nothing like that.
Any constipation? What about nausea or vomiting? Any changing in your bathroom habits?
No, I'm pretty standard on that.
Okay. And I know you said you had some stiffness in your knee. Any other aches, pains, anything like that? Any problems like lifting or moving anything? Any history of numbness or tingling?
No.
All right. All right. So, and you said you don't know anybody in your family that's ever had any psychiatric health conditions. What about physical health conditions? Heart attack, stroke?
My dad had was a high blood pressure or whatever. He's got a machine in his chest. I can't think of the name of it.
As a pacemaker?
There you go. I couldn't remember that.
Okay.
And there's been a couple cases of cancer, but outside of that, nothing that's...
What kind of cancers?
Ovarian and prostate.
Okay. So, you were married to your ex-wife until about 3 years ago. How long were you guys married?
It was about, about what, 12, 13 years, something like that. She got pregnant right before we got married, something like that.
Okay. And you have the 2 boys, 11 and 13, and they're with their mom?
For the summer.
And where is she?
She's about, 8 hours north of here.
Okay. All right. So, other than the marriage to your ex-wife, have you been married before?
No.
And you're not currently in a relationship now?
No.
All right. You said you didn't serve in our military. So, I'm just gonna ask you just questions about how you've been feeling. You just tell me yes or no. It's really, just to get a better idea of what's going on.
Okay.
So I know you said you felt kind of blah. Would you say you felt down?
Yeah, I guess you could say that.
Okay. What about loss of interest or pleasure and things that used to be really enjoyable for you?
I wouldn't say so. But, No, I don't think so.
Have you felt guilty about anything?
I don't think I would feel. I guess I might have felt guilty about how things ended with my ex-wife, but yeah.
Okay. And you said you're not sleeping as much, correct?
Correct.
Okay. Uh, and you felt a little tired.
Yeah.
And fatigued. Um, what about your social life? Are you like as active in your social life as you used to be? Or are you kind of staying more to yourself?
Outside of what I have to do for work, I've never really had much of a social life because of the kids. Because I'm always, especially since I got divorced, I'm having to take care of them since they're living with me. So, yeah, it's a little bit harder to have a social life.
What about engaging in activities? I mean, are you still engaging in things like you used to, or are you kind of just staying more to yourself?
I'm probably staying more to myself than I used to.
Okay. Are you feeling as much like get up and go as you used to? Are you feeling more sluggish?
I don't know that I feel sluggish, but I don't have the desire to go out as like I used to, I guess.
All right. What about having more energy than you usually do? Do you ever have times when you feel like you just have more energy?
No, unfortunately not.
Do you feel like you want and start doing all of these projects and stuff around?
No, I don't feel like that at all. I know that there's stuff I got to get done, but most of them just lazy.
Okay. All right. What about any feelings like someone can read your mind, or do you ever think that people can read your mind, or that maybe you can read someone else's mind?
No, absolutely not.
Do you ever hear voices?
No.
Okay.
I'm not crazy. I mean, come on.
That's not crazy. Those aren't crazy.
Oh, I'm sorry.
Do you ever feel anxious?
No, can't say that I would.
What about worrying about a lot of things?
I don't worry about my kids. Trying to raise them right and teach them not to get in trouble and all that kind of good stuff. But outside of that, no, I don't worry all that much outside of that.
Okay. What about, have you ever been involved in any kind of traumatic event? Maybe you were around when a carjacking or a car accident or something that was really stressful to you?
Can't think of anything.
Okay. Have you been having problems like remembering things?
No, I've got a pretty good memory.
Okay. Any history of attention deficit or hyperactivity disorder? Do you ever feel like you can't concentrate on things?
No, I pretty much have. I can concentrate when I feel like I want, or when I want to.
Okay. What about your eating? Are you eating like you usually do?
I mean, yeah, I've never really, I guess what they call it, had an appetite. I just eat on a schedule because I know I need to.
But is that normal for you? Is that kind of just how you always are?
Yeah, pretty much.
You just kind of eat because you have to.
Yeah.
Do you ever feel like you just eat a lot all at one sitting?
No, can't say that I have.
Do you ever feel guilty about what you eat?
No.
Do you ever tell yourself you can't have certain things, or?
No, I tell myself that I probably shouldn't eat this because I like ice cream, but outside of that.
When you eat ice cream, do you eat the whole?
Oh no.
So, in your mind, are you eating any differently than the people around you?
Not that I would say so, no.
Is your appearance or weight really concerning to you?
I've probably gained a few pounds over the course of the years, but I'm a little overweight. But
Is that
yeah, I mean,
stressful to you?
I probably should do something about it, but it's not stressful to me.
Okay, that's fine. All right, so we're going to go through some other questions. They may seem a little bizarre.
Okay.
They're questions that we ask everybody, and just do your best.
Okay.
There's nothing right or wrong.
Okay.
What year is it?
2016.
What season are we in?
In Arizona or elsewhere? We're in
Where
spring.
we are.
We're in spring.
Okay. What's today's date?
April 2nd, 2016. So
Okay. What day of the week is it?
Saturday.
All right. And you said that we're in Arizona?
Yeah.
Do you know what county we're in?
Maricopa.
Okay. All right. So I'm going to give you the names of 3 objects.
Okay.
And I just want you to repeat them back to me.
Okay.
All right. So ball,
Mm-hmm.
house, car.
Okay. Ball, house, car.
All right. So I'm going to ask you just to remember those. In a few minutes, I'm going to ask you about them again. Okay. All right. Can you spell world backwards?
DLROW.
Okay. So just a few seconds ago, I told you the names of 3 objects. Can you remember what they were?
Ball, house, car.
Okay. So I'm going to show you some objects. I just want you to tell me what they are.
Okay.
All right. What is this?
That's a watch.
All right. And what is this?
A mouse.
Okay. Can you repeat the phrase no ifs, ands, or buts?
No ifs, ands, or buts.
All right. So I'm going to give you a blank, this piece of paper. Can you fold it in half for me?
Okay.
And then can you place it on the floor?
Okay, there you go.
Yeah. Thank you. Can you make up a sentence at all? Right? It just has to be a complete sentence with a noun and a verb.
With a noun and a verb. I love my children.
Okay. I'm going to draw this picture for you, and I want you to just copy it.
Okay.
All right? Alright, so when you first came in, we had you fill out some paperwork. So we're gonna go through some of that right now, and then we'll talk a little bit more about where we are and where to go. Alright? So, with your drinking, have you ever felt like you needed to cut down on anything?
I mean, I probably wouldn't hurt to cut back, but I've never thought it would be. I thought it's an issue.
Okay. Has anyone else mentioned that it's an issue?
No, not really.
No one's voiced any concern about how much you're drinking?
No.
Or how often?
No.
Okay. Not even your neighbor?
No. Oh, okay. She complains every once in a while, but you know, she's my neighbor.
Sounds like you guys are pretty close.
I mean, we've lived side by side for a while, so I mean, she knows quite a bit about what's going on in the world.
Okay. Have you ever felt like you needed a drink to like get the day started?
No.
Or that you can't function without drinking?
No.
Have you ever felt guilty about how much you drink?
Only when I wake up in the mornings and I have a headache.
Okay. All right. So we had you do some of these other scales, and we'll go through them, and we'll kind of talk about them and see what you're thinking.
Yeah.
So this first one, we just had you read your symptoms over the past 2 weeks. In this subcategory right here about depression, you rated that more than half the days you felt little interest or pleasure in doing things, and you felt down, depressed, or hopeless.
Okay.
Didn't really have any feelings about being irritated or grouchy. You didn't say that you were sleeping less than usual and had lots of energy. You didn't say you were sleeping less, but that you were actually feeling kind of tired and fatigued.
Yeah, a little bit.
Not starting any more projects than you used to. You're really not having any feelings of nervousness, panic, or avoidance of any kind of situation.
No.
No unexplained aches and pains. Now, this one I want to talk to you a little bit more about. You said that just a minute ago that you hadn't had any feelings wanting to hurt yourself. But on this, you said thoughts of actually hurting yourself. You marked several days.
That probably has more to do with, and I'm not intentionally hurt, not intentionally worried. Sorry, excuse me. I'm not worried about intentionally hurting myself. I'm more worried about unintentionally hurting myself.
Okay,
If
can
I
you?
drink too much and fall downstairs or something like that.
Oh, okay. All right. Well, that explains it. Um, you didn't mention any. You're not hearing anything that other people can't hear.
No.
Experiencing other things that people can't.
No.
Um, you're having some problems with sleep. That's affecting how you do things every day. We talked about that a little bit.
Mm-hmm.
No real problems, and you're not feeling detached or
No.
anything like that. But you did say that you're not really sure what you want out of life, or what's really going, like where you really are in life.
Yeah, I mean, I just after a divorce and breakup with a married woman, I'm just not really sure what's there for me. That's all.
And you also said that you're not really feeling close to other people or enjoying relationships.
I've never really been one to have a lot of close relationships, and I guess that's more of a standard with me. I mean, I just don't. But right now, I just don't really feel like going out and meeting new people. Really.
Okay. You said you're drinking at least 4 drinks of alcohol most days.
Yeah, probably.
You're not smoking, and you're not using any other substances. No marijuana, no LSD, no PCP,
No.
methamphetamines, cocaine, nothing
No.
like that.
No,
Okay.
nothing at all.
All right. So this next question, you're kind of drilled down a little bit more on your emotion, on your thoughts and feelings. Okay.
Okay.
So we'll go through this a little bit more. You said that you often felt worthless, and that you often felt like you had nothing to look forward to.
Okay. I mean, I guess that's more of my personal life than my work life.
Personal?
Yeah.
Okay. And that you felt helpless.
Yeah, I mean, yeah, okay.
And you're feeling sad.
Mm-hmm.
That you felt depressed, unhappy, and hopeless.
Yeah, that sounds like how I feel about my personal life at this point.
So this tells me that you're feeling pretty severely depressed.
Okay.
What do you think about that?
I honestly I wouldn't have imagined that it would have fallen into that kind of category.
What you said in your personal life that you feel more nothing to look forward to. Tell me a little bit more about that.
No, I mean, yeah, I'm divorced. Probably could have done some things differently, but ultimately, I think it turns out the way it should have been. But to me, it still feels like a failure in a way. And I was dating a married woman, which should have known was a mistake in the first place. Did that for 2 years and just recently broke up. So, yeah, I'm just not sure what's there for me, what I'm supposed to be doing. So,
What about your professional life?
professional life, I'm fine. The job's great. Like my boss, like what I do. Don't have any issues as far as I know. So.
What kind of job do you do again?
I guess you could consider it sales. I'm an executive at a local company.
That sounds like it might be a little stressful.
At this moment, yeah.
Okay. This next one drills down. It's just it's very similar to this one, but this gives us more of a severity index.
Okay.
You said you have little interest or pleasure in doing things nearly every day. You're feeling down, depressed, and hopeless nearly every day. That you feel tired and have little energy. That you have trouble falling asleep or staying asleep. Sleeping too much. You have poor appetite or overeating. That you're feeling bad about yourself. You might be a failure, just like what we kind of touched on just a minute ago. No real problems concentrating, though.
No.
You're not really moving slowly or anything like that, or where people are concerned. And you did put here that thoughts that more than half the days you thought that things might be better off if you were dead, or that you thought about hurting yourself in some way. Can you tell me about that?
Yeah, and sometimes I guess that goes into my fears of failure. I guess maybe I thought that it'd be better for my kids if something happened to me and they could go live with their mom. Maybe they'd be better off. I don't know.
What makes you think they would be better off? Or is
I
that
don't know.
just
I think that's probably more fear and afraid that I'm not doing a good enough job with them.
Okay. All right. So this tells us that you're having some moderate to severe symptoms of depression. And I'm just wondering what you think about that. Because a little while ago, while we were at the beginning, you said that you're really not thinking that there's really anything going on, and this really didn't seem like a very big deal to you, or that something that really needed any attention. I'm just wondering what you think.
Well, I mean, in most cases, I would consider this compelling evidence that there might actually be a problem. So.
Okay. Sometimes it happens when people see it in writing.
Yeah.
It kind of illuminates things a little bit more for them.
Okay.
What kind of things do you do to relax?
Most of the days I just sit down and read or watch TV. So.
Okay. How often do you say you go out?
I go out if I need to for work. I'm going to go out to dinner or something like that. But ultimately, I don't really go out.
So you're pretty much just staying by yourself.
Yeah, pretty much.
Okay. So this last one that we had you do is just kind of how your symptoms are affecting different areas. Excuse me.
You okay?
Of your life. Yes. Thank you. You're having a little bit of problems communicating. Some more difficulty with starting and stopping conversations with others. Some more problems like getting out of your house, doing things socially.
Mm.
No real problems taking care of yourself, like getting dressed.
Yeah.
Eating or anything like that. You are struggling more with dealing with people with you don't know, and maintaining friendships and making new friends. Having more problems with.
I've always found it difficult to start new friendships or even just talk to people I don't know because I don't know if I'm just not a people person or what, but it's always been difficult for me to do that kind of stuff. But I never really made friends. It's all that easily. It's very difficult for me to trust people, and even then, they have to do something. Ultimately, I'm always afraid that people are just going to end up kicking me.
So you've had some bad relationships.
Yeah, I could see that.
Okay. So you've also had you indicated some issues like doing household chores and things like that.
Yeah, that's just laziness.
Okay. Tell me more about that.
Oh, I hate doing household.
Okay.
I hate doing chores. It just drives me crazy, but I know I have to do it. I just don't want to do it.
Okay. So you do them, you just
I just
don't really want to. All right. No real problem. You're not having a lot of problems, but you did say that, not sleeping and stuff is causing you to be a little more tired and maybe making your work a little bit harder and doing certain things well. That's what you marked here.
Yeah, I think I do them well. I just might not do them as well as I used to.
Okay.
I don't know, maybe.
What about doing them as quickly? Not really?
Probably not.
Alright. No real problems like getting around in the community or anything like that. You did say that you've been emotionally affected by what's been going on.
Yeah,
Tell me a little bit about that.
I guess that comes from the fear of failure scenario. I am a divorcee who just got out of a 2-year relationship with a married woman, so it doesn't really do well for the psyche, I would say.
You've brought that up several times. These 2 failed relationships. It seems like that's really affected you?
Never really been much of a failure at anything, and those the two things are really the biggest issues in my life. So yeah, and it bothers me, I guess.
All right. All right. So I'm going to tell you a little bit about what I kind of see and some suggestions.
Excuse me.
Are you okay?
Yeah, just had to yell.
And then we can kind of make some plans and think about where we go from here, all right?
Okay.
So I do think that you have depression.
Okay.
I think you have a moderate to severe depression. You're experiencing a lot of depressive symptoms. You're feeling them most days. And it seems to be affecting your life.
Okay.
I'm just wondering what you think about that.
I honestly, I wouldn't have thought it was an issue, but apparently, I guess I have something to work out. So I'm more shocked than anything, I guess.
Tell me a little bit more about the shock.
No, it goes back to the idea that my family's not really open to anything, and open to much emotionally. So I don't really know what to imagine. I wouldn't have thought that something like this would happen to me, but.
So it seems like it might be a lot for you to kind of digest all at once.
It's interesting. it's not what I would have expected. No.
It might be a little overwhelming.
Yeah, I guess you could.
It's a lot of information. I mean.
Yeah. So for it to be okay, here's what you answered, and here's what it says. I mean, you're the smart one, so yeah.
Well, we only use these as tools. Honestly, they're really only tools for us to kind of look at what's going on, and they help us measure progress as well, so we can use them later on, and we can say, hey, you were here, and now you're here.
No, that's fair.
You know? Okay. So they just give us they're just tools to use. They're your experiences, and we just try to help frame them for you so that you have a way to make a goal for yourself. So what are your goals?
Well, ultimately, my my goals are to have a happy life, take care of my kids, and I don't know what being happy means, but I hope that I would guess that somebody else would be involved, but I don't know.
So do you think that where you are right now is happy?
No, according to this, no. So.
But I'm asking you.
I wouldn't say that I was happy. I would just say it was kind of middle of the road.
Okay.
Just floating, going through life like I always have.
All right. The other thing is I think you have an alcohol abuse disorder. You said that you're drinking more than 4 or more drinks most days. You've had some issues or instances of not remembering what's happened. It's what we term blacking out. It's where your memory stops at a specific point, and then there's a period of time where you don't really remember what happened, and then you wake up and you're kind of like, oh, very similar to what happened today. Okay. You remember drinking, you don't really remember anything in between. Something happened and you have cuts, and you woke up in your neighbor's car.
Yeah. Okay, fair enough.
So that can compound your feelings of sadness and feeling depressed and kind of hopeless and helpless. And it's not uncommon either for people that are feeling down or depressed to drink. They often go hand in hand.
Okay.
So I would recommend that you start AA, Alcoholics Anonymous. I can tell by your facial expression that's not something that really appeals to you. So tell me about that.
Outside of the fact that I'm not a real big sharer. Just seems like telling my life to other people is not my cup of tea there.
And I understand that. I mean, it's scary to tell people what's going on in your world. There's fear associated with that. And you're not a very open person from what you've said.
No, I'm not.
There's some safety, as most of the people don't know you. so you don't have to worry about, that getting back
That's
to
true.
anybody else. And remember, you don't have to share. You can
Okay.
just go and listen to other people's stories, and if you feel compelled to share, you can. You don't have to. There's nothing that says you have to share.
Okay.
The other thing is I would recommend cognitive behavioral therapy.
You mean like talking to you on a daily
Well, like-
or a weekly basis?
Well,
or
like
something?
talking to me or somebody else, and we work on thought processes and how those affect behaviors, and vice versa, how behaviors affect thoughts, and how do we change those things and learn different ways of doing things.
Okay.
Cognitive behavioral therapy has shown to be very effective at managing and treating the symptoms of depression.
Okay.
Kind of think of depression as like diabetes or hypertension. We have to do something for the symptoms to kind of go away.
Okay.
And therapy is a very big part of that, because that's where we actually start changing behaviors and thoughts. And that's actually the root of changing long term. There's also the options for short term use or longer term use of medications if that's something that you want to try.
Okay. I'm not a big fan of medication, but
Can you tell me a little bit more about your reservations with medications?
well, I have a past history of drug abuse, but
Okay. What drugs did you abuse in the past?
marijuana and cocaine.
Okay.
So,
How long ago?
Oh, it was back in my college days. God, that's at least 10 years ago, at least. But
What caused you to stop?
I realized that I was going to lose my current girlfriend / fiance at that point,
Okay.
and honestly, it was probably on a course to ruin my life. So,
Okay.
and
Well, that's actually good news, because if you stopped using those,
yeah,
so you could stop.
but I also have an addictive personality, so.
Well, and that's where AA can help.
Okay.
That's where, though. People that go to AA have very similar behavior patterns and problems. And they can share with you what works and what doesn't work. They can be there to support you.
Oh, fair enough. Yes.
And I understand your hesitance with medications, but it is an option.
Okay, fair enough.
So, at this point, I can get you the names and numbers of some therapists that could work with you.
Okay.
And you can talk to them. And I would encourage you to find someone that you feel like you click with. So don't just feel like you have to go with the first person. The relationship you build with the person is where the true healing comes from. You have to have that trust and confidence in each other, and
Okay.
the ability to really share and talk and be open about what's going on.
Okay.
So I can get you that information.
Yeah, please. See how it goes.
And I can get you the names of some meetings.
Okay. And I figured if that's an issue, then we probably should give it a shot. So.
It doesn't hurt anything.
No, I guess not.
So, and it might make you feel better.
Maybe. We'll see.
And at least you can start figuring out maybe what happiness actually looks like. Because right now you tell me you can't really define that for me.
No, I can't. But
It's a hard thing to do.
I thought it was more about taking care of my kids at this point. So.
Well, you gotta take care of you too.
Fair enough.
Because that's how you model to your children to take care of themselves.
Oh, that's a good one. Gotta use that one on me. Anyway. Fair enough.
All right. Well, I really appreciate you taking the time to talk to me today.
Thank you.
All right. Have a great day.
You too.